The four most common congenital cardiac defects in the dog may be differentiated by auscultation and electrocardiography. The patent ductus arteriosus, seen most frequently in the female, represents a patent fetal connection between the pulmonary circulation and the aorta. The murmur, distinctive of an arteriovenous connection, is referred to as a machinery murmur because of its likeness to a noisy machine shop. The murmur occurs continuously throughout systole and diastole. Because the flow through the patent ductus varies with the comparative pressures in the left and right heart, the murmur is accentuated during late systole. This distinctive continuous murmur is best heard at the level of the aortic and pulmonic valves. Only a systolic murmur may be heard over the mitral and tricuspid valves. Listen to the continuous machinery murmur of a patent ductus recorded at the cranial thoracic wall of a dog. The murmur, associated with pulmonic stenosis, is a musical sound that builds in intensity until late systole and then diminishes. For this reason, it has been called a crescendo, decrescendo, or diamond-shaped murmur. It is a high-frequency sound heard most distinctly along the cranial left ventral thorax. Notice how the loud, intense sound heard with pulmonic stenosis may obscure other heart sounds. The crescendo-decrescendo murmur of aortic stenosis is often confused with the murmur of pulmonic stenosis. This murmur is heard over the aortic valve region and radiates to the cervical vessels and the cranial right thorax. The murmur may not interfere with the audible components of the first and second heart sounds. A defect in the ventricular septum permits blood to flow from the left to the right ventricle during ventricular systole. This produces a palpable thrill along the right mid-thoracic wall and a loud holosystolic murmur over the mitral and tricuspid valve regions. There is little radiation to the aortic and pulmonic valve positions. Note that the murmur of the ventricular septal defect is a harsh holosystolic sound not unlike that of mitral valvular insufficiency.